Hi, this is Dr. Fox, and let's talk about the ophthalmic artery and veins. In this video, we'll diagram the branches of the vasculature that serves the orbit, namely the ophthalmic artery and veins. Let's start with the artery. The ophthalmic artery is the very first branch off of the internal carotid artery. The internal carotid artery comes through the carotid canal and then gives off the ophthalmic artery. The ophthalmic artery then enters the orbit through the optic canal with the optic nerve. It is then going to take a curve medial within the orbit, and then most of its body, so most of the substance of the ophthalmic artery, can be found mostly medial in the orbit, sandwiched somewhere between the superior oblique muscle, which you can see has been cut here, and the medial rectus muscle. There are very many branches to the ophthalmic artery. We're not going to ask you to name them or identify them, but suffice it to say, most of them are named for their accompanying V1 branches. So, for instance, there is a lacrimal branch of the ophthalmic artery. There are anterior and posterior ethmoidal branches of the ophthalmic artery. There's a frontal branch and a supraorbital branch. So if you can think of a V1 branch, there's probably also an ophthalmic artery branch to match it. So the ophthalmic artery is the principal blood supply to the orbit, all of its components and constituents, and even some of the surrounding areas as well. The ophthalmic veins are the principal route of drainage of blood from the orbit, and there are generally two of these, but that can be rather inconstant. The general pattern, however, is that there is a superior ophthalmic vein and an inferior ophthalmic vein. This superior ophthalmic vein tends to drain the superior contents of the orbit, the eye as well, the ethmoidal sinuses, some of the superior head and face, because there are anastomoses with branches from the facial vein. That's how infections from the face can move from the face through the orbit and back to the cavernous sinus. The inferior ophthalmic vein, when present, drains the inferior contents of the orbit as well as portions of the deep face. It is very frequently in connection with the pterygoid plexus of veins in the infratemporal fossa. And both of these come together and are conveyed out of the orbit through the superior orbital fissure and drain into the cavernous sinus, and then can drain into other areas of the face as well. So this is the potential route of infection from the face to the cavernous sinus. That leads us to the assessment question of the video, and that is, through which opening in the cranium does the ophthalmic artery enter the orbit? Is it A, optic canal? Yes, that is the answer. B, inferior orbital fissure? Nope. C, superior orbital fissure? No again. So ophthalmic artery as well as optic nerve travels through the optic canal. Thank you so much for your time, and I'll talk to you in the next video.